Knock knock.
Come in.
Hi, how are you doing?
I'm good.
My name is Valentina. I'm a Broward College nursing student. I'm going to be performing a physical exam, a pain assessment, and taking your vitals. I'm going to have to, it's going to require for me to touch you. Is that okay with you?
Yes.
Alright, are you comfortable? Do you need to use the restroom because it's a lengthy assessment?
No.
Alright, are you allergic to latex or any allergies I should know of?
No.
Alright, so I'm going to provide privacy by closing the curtain, wash my hands, put on my gloves. Can you tell me your name and date of birth, please?
John Doe. Date of birth 3/31/1972.
Alright, thank you. So I'm going to assess for JVD. I'm going to have you lay on your back.
Okay.
I'm going to remove the pillows from under your head. I'm going to have you face the other way, and then I'm going to raise the head of the bed 45-degree angle while checking the JVD. No JVD noted. You can go back down. And then I'll repeat the same thing on the other side. Alright, you can sit back up.
Okay.
Alrighty, so now I'm going to do a pain assessment. Are you experiencing any pain?
Yes, I have a headache.
Okay, and on a scale of 1 to 10, 10 being the worst.
I'd say it's 5 out of 10.
Right? Okay. And do you know when the pain started?
Started about a day and a half ago.
Do you know how long it lasted?
Lasted for a few hours and it went away. Then it came back.
Okay, and have you done anything to maybe make it better or anything that has caused it to get worse?
What causes it to get worse is like, staring at like a TV screen or a really bright light. What I've done is I've taken Tylenol and ibuprofen. It helps a little and it goes away, but temporarily then it comes back.
Oh, okay. And does it radiate to anywhere else?
No, it doesn't radiate. I mean, it just wraps around from the back. I feel like it's like I have a headband on.
Okay.
It comes all the way to the sides here.
All right. And can you describe the pain? Is it like pressure, dullness?
Yeah, it's like a pressure. Yeah, it's like a pressure.
Okay. All right. So I'll notify the doctor. So then I'm gonna move into taking your vitals. All right.
Okay.
All right. So I'm gonna start with the blood pressure. So I'm going to do a palpable systolic by palpating the brachial artery. So I'm going to pump until I don't feel the artery pulsating anymore. Okay, so it stopped at 140, and then I would pump from there. So his palpable systolic is 140. From there, I will pump it up 30 degrees of mercury higher than that as my baseline to start the blood pressure. All right. So I'm gonna pump the cuff to or inflate the cuff to 70 to 170. Alright, so 122/74 is your blood pressure, and that's between normal range. A normal blood pressure is a systolic of of 90 to 120, and then a diastolic from 50 to 80. So your blood pressure is normal, okay?
Thank you.
So now I'm going to take your temperature. Alright, I'm going to have you raise your armpit. And I'm going to make sure it's touching skin to skin with the thermometer. And a normal temperature is 36 to 38 degrees Celsius. And in Fahrenheit is 98.6 to 100.4. All right, and then yours is 36.5, so that's normal, okay?
Thank you.
All right, so now I'm gonna check for your pulse. And a normal pulse is between 60 to 100 beats per minute. And I'm gonna be checking this on the radial pulse, radial artery. Okay, so hold on. Okay, so the pulse is it was 75, and I also checked for respirations, and it was about 14. So normal respirations is between 12 to 20 respirations per minute. So everything is normal, okay?
Okay.
And then the pulse ox I would apply to the index finger, and it is a normal pulse ox is between 95 to 100%. Alrighty, so then I'm gonna move on to cranial nerves. Alright, so I'm gonna assess all the cranial nerves at once, and then I'll proceed to the head to toe. So to assess for cranial nerve 1, to test that, I'm gonna have the patient, which is the olfactory nerve, I'm gonna have the patient differentiate and tell me between two distinct smells. So this is a coffee bean, and then this is cinnamon. All right, so I'm gonna have you close your eyes and then obscure one nostril. So cover one nostril. Can you tell me what this is?
Coffee bean.
All right, and then can you repeat the same thing on the other nostril? Can you tell me what this is?
Cinnamon.
Yes. Okay. All right, and then cranial nerve 2 is the optic nerve. So I'm gonna be assessing your eyesight. Do you wear any contacts or lenses?
No.
Alrighty. So standing about 20 feet away from the patient, can you tell me this first line, what that says?
Valentina Peraza.
Oh, sorry. Can you cover one eye, please?
Sure.
All right. Can you tell me what this says?
Broward College.
All right. Can then you repeat the other side? Cover the other eye. Can you tell me what this says?
Student.
Okay. All right. And then I'm gonna assess. You can put your hand down. Thank you. All right. So now I'm gonna check your eyes. There's gonna be light to your eyes, so it might be a little uncomfortable. Okay.
Excuse me.
No, it's okay. All right, so I'm gonna be checking the pupil size, and if it's reactive to light, and pupil size is 33 millimeters. And then I'm gonna check for accommodation. So I'm gonna have you look at the pen light and then look at my nose. So look at the pen light and then my nose. Okay, pen light. Okay, so patient's eyes are, well, pupils are equal, round, and reactive to light and accommodation. And then moving on to cranial nerve 3, I'm gonna assess cranial nerves 3, 4, and 6. Cranial nerve 3 is ocular motor. Cranial nerve 4 is abducens, and cranial nerve 6 is trochlear. So I'm going to be doing the 6 cardinal fields of gaze. So I'm gonna have you just follow with your eyes, just your eyes, the pen. So I'm gonna follow here, that's 3 and 3. Down here it's 3, cranial nerve 3 and cranial nerve 3. Here by the side is cranial nerve 6. The other side is cranial nerve 6. And then the inner corner is cranial nerve 4. All right. I'm next gonna be assessing cranial nerve 5, which is trigeminal. So for trigeminal, I'm gonna have be assessing your for TMJ. So I'm gonna have you open and close your mouth, and then move your lower jaw from side to side. All right, I don't feel any clicking or locking. Does it hurt when you do that?
No.
Alrighty. I'm gonna have you also, I'm gonna assess your sensation of the 3 branches of the trigeminal nerve. So this is sharp, and then this is dull. All right.
Okay.
So I'm gonna have you close your eyes, and can you tell me what this is?
Sharp.
And then this.
Dull.
Alrighty, and this.
Sharp.
All right, good. All right, now next I'm gonna move on to cranial nerve 7, which is the facial nerve. Can you smile for me? Can you frown? Can you raise your eyebrows? Okay, can you puff out your cheeks? All right, so they're resistant to my pressure. And then to assess for sour or bitter, sweet or sour, right? Can you just for test purposes tell me, name something that's sour?
Sour candy.
Okay, and something that's sweet?
Ice cream.
Okay, all right. So moving on to cranial nerve 8, which is the vestibular trochlear, which is the acoustic nerve. I'm gonna have, well, can you face that way, please? Like your body. Thank you. So I'm gonna come behind the patient and just whisper a word that has 2 syllables, and then you can repeat it back to me, okay?
Blueberry.
All right, can you go to the other side, please?
Watermelon.
Yeah. Alrighty. Do you use any hearing aids? I should have asked you before this, but
No.
Okay. Alright, so now I'm gonna move on to cranial nerves 9 and 10, which are the glossopharyngeal, which is 9, and then 10 is the vagus nerve. I'm gonna assess both of them together. So can I have you please open your mouth and say ah? All right. So the uvula moves midline, and then with the blade tongue, I would check for gag reflex. And then for phonation, I'm gonna have you say the sky is blue. Can you repeat that?
The sky is blue.
All right. So his phonation and word articulation, it sounds good. It doesn't sound like nasally. So then I'm gonna move on to, did I miss anything? Hold on. Phonation, gag reflex, okay, in speech. Okay, so I'm gonna move on to cranial nerve 11, which is spinal accessory. And so I'm gonna have you shrug your shoulders against my resistance. Spinal accessory. Okay, can you move your head up and down? And then can you move against my hand to the side? Then the other one. Alrighty. I think that's it for spinal accessory. And then cranial nerve 12, which is the glossopharyngeal. So can you stick out your tongue, move it side to side, and then up and down. Okay, can you repeat D-N-L-I?
D-N-L-I.
Okay, so his articulations of the words are good. So cranial nerves 1 through 12 are grossly intact bilaterally. And then for the, I just remembered, for the glossopharyngeal, for cranial nerve 9, I'm going to assess the taste for bitterness, for something bitter, so sweet and salty, and then, okay. And then bitter and sour. Can you name something that's bitter?
Yeah, like a lemon.
And then something that's sour?
Like a sour candy.
Yeah, okay. So yeah, so cranial nerves 1 through 12 are grossly intact bilaterally. Alrighty, are you comfortable? You good?
Yes.
Okay, so everything's good so far. I'm gonna move on to do a general assessment. So from following the commands you've been following that I've been telling you, so patient's able to follow commands. He looks like he has good hygiene. He articulates his words well. And then you told me, can you tell me what you're here for?
Yeah, I'm here because I have a headache that doesn't go away.
Okay, so patient by his name and date of birth and the reason why he's telling me the reason why he's here. So patient is awake, alert, and oriented ×4. Alrighty, so now I'm gonna move on to the head to toe. So I'm gonna start off by inspecting the head, the scalp. I don't see any alopecia, no head infestations. So then I'm gonna move on to with gloves by palpating for any masses, lesions. I'm gonna be checking for, again, any infestations. Do you feel any pain when I touch?
No.
Okay.
A little, like on the side.
On the side, okay. All right, so then I'm going to change my gloves, hand sanitize, put new gloves on. I am going to then move on to the face. It's symmetrical, palpate for skin temperature, it's warm. The color is fair. I'm gonna be then moving on to the eyes. These are with new gloves, so I'm gonna I'm gonna pull down the lower lid. I'm gonna have you look up. I'm gonna check that the sclera is white, the conjunctiva is pink and moist. Then I'm going to palpate the lacrimal gland. Is there any pain?
No.
Okay, I don't see any drainage. That's unusual, right? I'm gonna palpate the bone, the brow bone. Is there any pain?
No.
Okay. What else for the eyes? They're equal. I already checked perla. Okay, so then I am going to move on to the ears. I'm gonna check for any drainage or excessive cerumen, and then the same with the other side. Okay, everything looks normal. And then I'm doing this by pulling on the pinna up and back. And then I'm going to be palpating the pinna, the outer ear, the mastoid process. Does this hurt?
No.
Okay, and then the other mastoid. Does this hurt?
No.
Okay. And then the ears, the helix is symmetrical with the eye, the angle, which lower set ears would indicate for Down syndrome, which you don't have that. Okay, so then I'm gonna move down to the nose. I'm gonna have you close your eyes so it's not uncomfortable for you. I'm going to inspect the nose, check if there's any polyps, any lesions, any excessive or abnormal drainage. The nose is midline, there's no septal deviation. All right, you can open your eyes. I'm gonna have you cover one nostril and then breathe through it. Is that comfortable for you? Can you breathe?
Yes.
And then repeat on the other side. All right, so the nares are patent. And then I'm going to, do you have any respiratory conditions?
No.
Okay, do you have any difficulty with breathing?
No.
Okay, so now I'm gonna move on to the mouth. Okay, the lips are symmetrical and pink, right? I'm gonna have you open your mouth, please. Okay, it's pink and moist. The mucosa is pink and moist, right? There's no bleeding gums. Can you lift your tongue? Okay, the frenulum is midline. There's no missing teeth. I don't see any dental caries that are visible. There's no bleeding. There's no foul odor. All right. Is there? Do you have trouble swallowing?
No trouble swallowing.
No. Okay. Alrighty. So I am going to move on to the neck. I'm gonna inspect for anything that's deviated. I'm gonna inspect the skin. There's no masses, no lesions. Everything looks pretty normal. And then I'm going to, I'm gonna palpate the temporal pulses. Okay. All right, so they're +2 bounding. And then moving back down to the neck, I am going to then palpate for his trachea, making sure that it's midline. So I'm gonna move it a little to one side. Is there any pain with that?
No.
Okay. And then I'm gonna assess the thyroid. Can you please swallow? Okay, so the thyroid moves up and down how it's supposed to when he swallows, and I didn't notice any thyroid nodules. And then I did mention the trachea is midline. All right, so then I'm gonna auscultate and, well, I'm gonna palpate first for the carotid artery on each side. Okay. All right, it's +2 bounding. Now I'm gonna auscultate the carotid arteries. Okay, no bruits noted, and the pulses are +2 bounding. Okay, so now I'm gonna move on to the lymph nodes. Actually, I'm gonna first go back to and just palpate for his sinuses. So, is there any pain while I do this?
No.
And then the maxillary ones?
No.
Okay, and then I'm gonna now palpate your lymph nodes. So the pre-auricular lymph nodes, the post-auricular lymph nodes, the submental lymph node, the cervical lymph nodes. Any pain while I do this?
No.
Okay. And then the occipital lymph nodes. Okay. There's no swelling. The lymph nodes look good, feel good. All right. So then now moving down to the chest, I would actually be like exposing the patient, but testing purposes, this will do. So I would inspect the skin for any lesions, for symmetry, right? I'm gonna palpate for any pain. Does it hurt?
No.
Okay. Oh, also, have you had any head trauma or
No.
falls?
No head trauma, no falls.
Okay. So moving back to the chest, I'm gonna be assessing the heart. So I'm gonna be walking the heart places, right? So right of the sternal border, second intercostal space is the aortic valve, where S2 is louder than S1. And then left of the sternal border, second intercostal space, S2 is also louder than S1. And then moving down to the third intercostal, left of the sternal border is Erb's point, where S2 is equal to S1. And then on the fourth intercostal space, left of the sternal border is the tricuspid valve, where S1 is louder than S2. And then moving down to the mitral valve, fifth intercostal space, left of sternal border, mid-clavicular line, is the mitral valve, and S1 is louder than S2. And right here, I'm going to then auscultate all these parts of the heart. The aortic, the pulmonic, the Erb's point, the tricuspid valve, and the mitral valve. And I'm also going to listen with my bell. Aortic, pulmonary, Erb's point. Fourth intercostal is tricuspid, and fifth intercostal is Erb's mitral valve. So no buries noted, and then I'm gonna listen for a whole minute to listen to the PMI, which is point of maximal impulse of the heart, which it should also be between 60 to 100 beats per minute, and it should match the radial pulse. Okay, so it's 75, which does match, I believe, the radio pulse that I took earlier. And like I said, no breeze noted. So now I'm gonna move on to the lungs. I'm going to, oh my gosh. Okay, I'm gonna move on to the lungs. I'm going to auscultate all the points, right? So there's 8 points in the front, 4 laterally, and 10 in the back. So let's do this. Okay. So can you inhale and exhale for me? Sorry, give me 1 second. Okay. And then the other side. Oh. So these two are bronchial, I'm sorry. Yeah, they're bronchial sounds. Let me know if you get lightheaded at any point. We can take a break. Okay, so lungs sound clear bilaterally. So these are bronchial sounds. These are 4 are vesicular bronchial sounds, and then these are just vesicular lung sounds. So I'm gonna move on to the lateral, right? I'm gonna do it here. Can you scoot over, please, Lynn?
Sure.
Hold on. I'm just gonna check if I can see. Okay, yeah, we can see. Okay, so there's 4 lung sounds here on the side laterally. So can you breathe in? Okay, all sounds clear. Then I would repeat it on the other side. Okay. Okay. And then they also sound clear. Are you feeling good?
Good.
Okay, let me just check if it's still recording. Okay, yeah, we're still recording. All right, so I'm gonna check the back. So I'm gonna have you, face this way, and then you can scoot a little over. Alrighty, so there's 10 sounds in the back. Okay. Can you breathe in and out? All right, so all the lung fields sound clear, and I auscultated avoiding the spine and the scapular bone so I can listen. All right, you can face me now. Okay, so now I am going to move on to, we did thorax, okay. I'm gonna check the chest excursion, so I'm gonna do front and back. All righty, can you breathe in? Okay, and then in the back. Sorry, I keep having you flip back and forth. Okay. Can you inhale? Okay, exhale. All right, so it's normal chest excursion. I'm sorry, I'm gonna keep you back here. I'm also going to inspect the spine, that there's no lesions, any masses, any moles, abnormal moles, any skin breakdown, especially in the coccyx area. All right, so everything looks good. And then I'm gonna have you stand up, please, and bend over so I can check your spine. Okay. Okay, the spinal curvature is normal. Usually I would have this, you know, with the skin exposed, but yeah, everything looks good. All right, you can come back up. Sorry. Okay. Then I am going to move on to the abdomen. So I'm gonna just have you just lay back. Okay. I'm going to inspect that the abdomen is symmetrical, that I don't see any masses, any bloating. All right, so then I'm gonna move on to auscultating.
I'm gonna lift my shirt up.
Yeah, you can lift it. All right, so I'm gonna start from the right lower and then move my way up to the other side. Right lower, right upper, left upper quadrant, and left lower quadrant. Okay, so he has normal bowel activity, which is 5 to 35 bowel sounds in a minute. And if the patient was hypoactive, it would be less than 5 sounds per minute, which I would then have to auscultate for a full 5 minutes before I document, you know, no bowel sounds. I'm now gonna go ahead and palpate lightly. So you're gonna tell me if you feel any tenderness? No?
No.
Do you feel bloated?
No.
Okay, are you going to the restroom regular? Yeah?
Yeah, I went to the restroom regularly.
Regularly? Okay. When was your last bowel movement?
This morning.
And was it normal for you?
Yeah, it was
put your
normal.
shirt down. Okay, and are you experiencing any nausea or vomiting?
No.
Okay, what else? Nausea, vomiting, bowel movement. Okay, and then are you urinating normally, like the frequency?
Yeah.
Yeah.
I'm going up like every, 3-4 hours.
Okay, and can you tell me the color of your urine?
It's like light yellow.
Yellow, okay. Do you notice any blood in your urine?
No.
Okay, any foul odor?
No.
Any pain or burning on urination?
No.
Okay. Okay, so now I'm going to move on to the extremities. Okay, so for upper extremities, I will inspect the skin, that they're both symmetrical, both arms. Any abnormal moles, any bones, like, you know, deformities of the bones, any masses. Okay, so then I'm gonna go ahead and what am I gonna do? Okay, I'm gonna assess for range of motion. So I'm gonna have you do a abduction. Okay, and then a deduction. Can you pronate your hands and then put them supine? Okay. Can you flex for me? And then extend. And then can you push against my hands? Can you pull against my hands? Can you squeeze both my hands simultaneously? Okay. So patient has good range of motion and strength. I'm gonna check for capillary refill on the hands, on the fingernail. Okay, and the blood returns less than 2 seconds, so it's brisk. I'm going to check the temperature, which is warm. The color of the skin is fair. It's pink. It's not blue. And then I'm going to assess for the pulses. So then I'm going to palpate the brachial pulse on both bilaterally, the radial pulse, and the ulnar pulse. Okay. So now I'm going to assess the. I think that's it. I don't know. I'm gonna move on to the legs. Okay. So, any clubbing of the fingernails, which would indicate low perfusion or any other perfusion disease related to the patient. Okay, so I'm gonna have you lay back. I'm going to inspect the legs for symmetry, any bones that are, any deformities, for any moles. The hair distribution is normal. I'm gonna inspect the skin, which it's fair, it's pink. The toes, good hygiene. The nails. I'm gonna also palpate for capillary refill on both. Okay, and it's brisk. It returns less than 2 seconds, the blood. I'm going to then assess for range of motion. So I'm gonna have you stand up, please. Can you abduct your leg? And then abduct it, yeah. Then with the other one, abduct it and abduct it, okay? And then you can sit back down. Can you dorsiflex your feet?
Like this.
And then plantar flex both feet, okay? Can you push against my hands? Okay, and push up? Okay. Can you invert your feet? And then eversion? Okay. So range of motion and strength is good. I'm going to palpate the pulses. I'm gonna just check if it's, okay, I'll check it again, but I hope it's still recording. Anyway, sorry. I'm gonna palpate for the pulses. So I'm just gonna verbalize that I would palpate the femoral pulses, arteries, which are at the groin. Then I'm gonna palpate for the popliteal pulses bilaterally. Okay. And then the posterior tibialis, which is next to the Achilles tendon. Alrighty, and then the dorsalis pedis, which is on top of the feet. Alright, so patient has all pulses and they're +2 bounding. I'm going to also inspect and palpate for edema. Okay. Okay, no edema noted. And then I'm going to inspect or rule out any DVTs. So I'm going to inspect to see that there's no redness and swelling, swelling or heat. So it's not too hot, there's no redness, and there's no swelling on either legs or calves. So then I'm gonna also rule out for DVT by doing the Holman sign test. So I'm just gonna lift your leg, and then I'm gonna dorsiflex your foot. Does that hurt your ankle or your calf?
No.
Okay. And I'm gonna repeat the same thing. Okay, dorsiflex. Does that hurt your calf?
No.
Okay. So with Holman's sign, he's negative for DVT, according to Holman's sign. Okay. I think I'm done with my physical assessment. Oh, no, I'm not. No, I'm not. Okay. Do you need help with ambulation?
No.
Okay. Or any assisted devices?
No.
Also, do you use supplemental oxygen?
No.
Okay. Do you smoke?
No, I don't smoke.
Do you use any other substances?
No.
Okay. And are you having any suicidal ideations of hurting yourself, hurting others?
No.
Okay. And do you have a history of abuse?
No.
And do you feel safe at home?
Yes.
Okay. Are you comfortable and safe here?
Yes.
Okay. And then I would also do a fall risk assessment as followed. And then I would, now that I'm done with the physical assessment, I would wash my hands per CDC. And then I would lower the bed back down to lowest position. Make sure the brakes are locked. I will put the call light in reach within the patient, and I would put the side rails up ×2 because I don't want to restrain the patient, so I don't want to put them by 4. Okay. Are you comfortable?
Yeah, I'm comfortable.
Yeah. Okay. All right. Well, thank you for letting me do the assessment.
Thank you. Very thorough.
Okay. Okay.